And now I have the pleasure of introducing my colleague, Noël Gordon, and Deborah Levin. In addition to being one of my favorite colleagues, sorry you guys back in the back, Noël Gordon has distinguished himself as an influential advocate for HIV/AIDS prevention and treatment education. He currently works at HRC Foundation as a project manager, where he develops strategic plans and partnerships for foundation programs, focusing on key priorities initiatives like transgender equality, HIV/AIDS awareness, and racial and ethnic diversity. He was recently named one of National Black Justice Coalition's 100 Black LGBTQ and same-gender loving leaders to watch. And he'll be joining us in a moment. Deborah Levin will be joining him. And Deborah is the director of the Online Health Education for Planned Parenthood Federation of America, where she works to translate Planned Parenthood's education needs into digital strategy for the Federation. She has worked as a public high school teacher and a sexuality educator, trainer, and teen peer education coordinator at Planned Parenthood of Connecticut, where she developed culturally competent lesson plans, activities, guidelines, and resources on sexuality education. Please give a warm welcome to Noël and Deborah.
How are y'all doing? Good. So let's talk about sex.
By a show of hands, how many of you had sex ed when you were in school?
Okay.
Great.
Okay, hands back down. Now, how many of you had what you would basically say was abstinence-only based sex education?
Okay. And last question, how many of you had sex ed that addressed sexual orientation and gender identity in an affirming way?
An enthusiastic but small group. And that is exactly why Planned Parenthood and HRC are partnering right now.
Yep. In fact, HRC and Planned Parenthood have been working together on political advocacy for many years, but we're now teaming up in a new way that's more directly relevant to your work. We'll be working to address the challenges that LGBTQ youth face in school and beyond.
Now, if it's not clear by this conference, HRC cares deeply about this issue.
But you may be wondering why Planned Parenthood. You probably know Planned Parenthood as the nation's leading provider and advocate of high-quality, affordable health care for women, men, and young people, as well as the nation's largest sex ed provider. What you may not know is that Planned Parenthood provides a variety of services for LGBTQ youth clients, clients, including youth groups, professional training on LGBTQ cultural competence, as well as hormonal treatments for transgender clients. And we want to expand that work.
To that end, last year, HRC and Planned Parenthood worked together to conduct focus groups and individual interviews with a total of 92 LGBTQ youth from across the United States to understand even more about their lives and gather ideas on how we can use digital means to help LGBTQ youth. In the next minute or so, Deborah and I would like to walk you through some of our key findings and some few quotes from the youth themselves.
First off, we came into the process thinking a lot about sex education, but what we heard from the youth really was much more how much emotional wellness was an issue. And there's a quote here from an 18-year-old who said, "Sometimes I get really, really stressed out and really severe anxiety. It stops me from doing things that are body healthy or mentally, emotionally, physically healthy for me. Sometimes I'll just sleep all day long instead of doing things about it," if that makes sense.
In terms of sexual health education, very few of these young people had any education about sexual orientation or gender identity or affirmation of the continuum identities that they live. A quote from an LGBTQ youth on sexual health and education sounded like this, age 16. Protection is something you need, blah, 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 but it's always taught with straight sex. So I think a lot of gay teens who get a little confused, or they get a little like, oh, well, I'm not going to get to that.
The last key finding that we wanted to share is that youth can and do find support, community, and information online, but they clearly state that they want more and better resources to do this. And so the last quote, I'd like to see a way to be able to chat with other LGBTQ youth, either in your area or just around other countries, to talk and discuss issues we're having, or have forums where they can post their problems and just discuss them.
So we are going to try to build some of these resources, HRC and Planned Parenthood, in the digital space, and continue our advocacy together to make sure sex ed programs are affirming of sexual orientation and gender identity.
At next year's Time to Thrive, we hope that we will be sharing something concrete or electronic with you. We really appreciate your time to hear us out with this announcement, and we really thank you for your dedication to the LGBTQ youth of America.
Thank you.
Thank you.